I had anterior hip replacement surgery with Dr. Bonenberger. What led me to this surgery was June of this year. I hit a wall. I woke up and had this severe pain, thinking it might be my old lower back problem again acting up. And it was just a progression of just from bad to worse. And I went to my practitioner, my GP, and he took an x-ray, and he says, "It's not lower back pain, dear, it's your hips disintegrated." So it was a surprise and a shock. But he referred me to the center here, and that we just went from there. And after the initial shock wore off, they were able to tell me they could fix it. So that's all I wanted to hear was, okay, you mean they can fix this? Because after even several weeks waiting for the surgery, it got to where I wasn't walking. I couldn't move. I couldn't do anything. Well, I had a month to prepare for it because I waited till Dr. Bonenberger could put me first thing in the morning on that Wednesday. And that's when he was available for it. We picked the best hospital that he likes to practice at. It was surprisingly just effortless. Everyone was ready for me there. Everything's set up there waiting for you. You have a surgical staff that's first class. All of his folks from the center is there. His choice, I guess, nurses and anesthesiologists, what have you, they're all there. They're ready for you. And after all of the anxiety, you know, it just was over, and I woke up, which was the whole point of the surgery. And my daughter and my husband was there, and it was just, I guess, painless, in that not only painless surgery because they take good care of you, but it was effortless, and you had no worries once the anxiety wore off. You know, I mean, you wouldn't be human if you didn't have a little anxiousness for the thing. But once you're there, they take care of you, and then you just calm down, and it's over in a couple of hours, maybe less. Well, the day of surgery, I was able to stand up and put weight on it with the walker, but holding on. And I did so well that I was home. I went in on Wednesday, and I was home Friday morning. So I was home in 48 hours. Then you have in-home care, if you so choose. I did choose that for the first week, and I was off the walker. I was on the cane for another week and off my pain medicine totally in 2 weeks, and walking around without a cane in 3 weeks. So it was just, you have to get your balance back and your muscles strong again. You haven't used them in a while, so you're off balance. And for all the girls out there, I got up about 3/4 of an inch taller, so it was quite nice. So I mean, clothes fit better. So it was all in all, I would say, very fast, surprisingly fast. This surgery is extremely, it's minimally invasive. The scar is only maybe 4.5 inches long. So that part of the recovery is even faster because you're not dealing with something that's intruding through tissue and tendons and nerves and what have you. So the recovery is a lot faster with this anterior approach. Well, I have it back. I mean, I hit the wall, and I wasn't sure where it was going to go. So I have my life back, and I can go as far and get as better as I want to work towards. But I mean, I can go hit a basket of balls to my daughter, and she can practice her tennis. I can serve over and over to her and volley in all different directions. I can drive. I can shop. I can go to the grocery store without, well, I can walk. So I can't best describe it, but you have your life back to do with it what you want. And I have my family back, so it's wonderful. So to be able to spend the time with them, you know. Absolutely, it works. They know what they're doing here. The doctors here, whether it's your shoulder, your knee, replacement backs, feet, in my case hip. I mean, these guys are awesome. They'll take care of you. They'll fix it. And they won't do it unless they know it will benefit you. They won't recommend something that's not going to benefit you. So, absolutely, I recommend this procedure if you need it. And I obviously did, so I'm all well. So it's been a life changer for me.